Hi, my name is Jordan Harding, and I will be showing the goniometer measurement for hip extension. First, we're going to start with our patient standing and have their hips right on the edge of the table. So go ahead and hug your right leg as you lay back into a supine position. So we'll have our patient start that way, so when they lay back, their testing leg can fully extend into hip extension if it has that ability. And then we're going to have them hug their knee so that they maintain, first off, their lower back stays in a flat position, as well as their pelvis stays in a posterior rotated position, thus our neutral position for this measurement. The points that we're looking for the goniometer, we're going to come here on the lateral aspect. We're going to feel for that greater trochanter of the femur, and then that's going to be our access point, and then our stationary arm is going to go again the midline of the trunk, parallel again to the center of the trunk there. Our movement arm is going to follow the lateral aspect of the femur, kind of heading down towards the lateral epicondyle. So get our goniometer ready for measurement, and then as far as hand positioning, we're going to have one hand here on the ASIS, and I also like to have the index or middle finger reached around to feel the iliac crest or the PSIS, whatever your hand can reach. With the other hand, you're going to raise it into hip flexion, so we're going to feel for the point of first resistance as we lower into hip extension. So again, have our individual completely relax, and we're feeling for that first point of motion. I should say we're feeling for the first point of motion where that ASIS starts to move forward into an anterior rotation. Hold right there. You can go ahead and stand up. So for her, I have her at +1. Go ahead and hug your left leg now and lay back. Hand position on the ASIS and the posterior side of the hip with the testing leg. Again, our individual getting her to relax, and then we're going to move into hip extension. Hold right there. So you go ahead and stand up. So for the right leg, I measured 9 degrees. So we have a little bit of a difference from 1 degree on the left side and 9 degrees on the right. And again, it's important to remember that we measured her in a positive, so she has a little bit of hip flexion. She can't fully go into hip extension, and the optimal measurement for hip extension would be 0 to -10 degrees.